Welcome to the Do Life Well podcast. Join your host, Gavin Merwin, and his guests as they explore the nature of doing life well. Now, let's dive in.
Well, welcome back to another episode of the Do Life Well podcast. I'm your host, Gavin Merwin, and I'm super excited today to be joined by Miss Susan Bradshaw of EnSpire Counseling and Wellness. Maybe I got that right?
That's right.
Okay, perfect. Episode 27, it will air on August the 1st, and it's titled, Most People Never Go, but Most People Probably Should. So, got a lot of great things to unpack today. First, just thank you for coming. Thank you for being willing to spend a Friday afternoon with me.
Sure.
So let's start with your story. Just tell everybody just a little bit about yourself, your career, your path, your family, anything you want to share, just to kind of give them a picture of who you are before we kind of dive in.
Okay. Well, I was raised in South Georgia, and I have worked in, this area all my career, which is going on like 30 years.
Wow.
I've worked in different areas of mental health. I've been married about 25 years. I have 2 children. So living in this area, I just wanted to give back and help others. I'm a Southern girl, so this is where I stayed and worked. And have developed and learned a lot and worked with a variety of people in this area, not just like, Lowndes County where my office is, but surrounding counties that come to us.
Sure.
Like Cook County and, different counties around us. So.
Yeah. What's kind of your educational background? And I don't even know this, but is there certifications in your field, or is there different, walk me through the different areas, I guess.
You normally get a bachelor's, and mine was in psychology.
Okay.
And then you have to go into a licensure track. And so now they do it a little bit differently. When I was going through, it took a little longer than it does now. And so I had to get a master's degree. And then after that, I had to go into what they called a postmaster's degree or certification. And so you got your master's, and then you went into this postmaster's program, and then that set you up to become licensed.
Okay.
So now it's a little different. It's structured differently, but back then that's how they did it, and it took just a little bit longer than it does now to become licensed. After you get your postmaster's, you have to work so many hours and gain supervision all that time, and then you can qualify for licensure, and you have to apply for that and show them that you've met all those requirements, and then you can sit. Well, back then you could sit for your exam.
Gotcha.
And if you passed, you got your license.
Okay.
And now they do it, like I said, it's a little different, but that's the process I had to go through.
I gotcha. What's kind of your typical day look like? Who are you working with normally? And I know we were talking before we started about how that's even shifted relatively recently, so you can kind of tell that story about different places you've worked and that process too.
Yeah, well, now I'm in private practice. So, I've been there about 6 years. I was in private practice in the late 90s before. And with insurance and the way it was back then, it was just hard to keep up with that, and I worked another job too, so eventually, I got out of that and just focused on my full-time position. But right now, I'm more of a faith-based counselor, and I really got into that over the last 1 year. I just felt like at this point in my career, that's what I wanted to do, and God just laid it on my heart to do that. As a Christian, as I've told you before, I just feel like, you need God to heal.
Yeah.
And so I just felt really God pulling me in that direction, and so that's what I've started doing. I do a lot of the same things I've always done with clients, but we do bring God into it, and there's that spiritual part that we talk about. I don't preach to people because I'm not trained as a preacher.
Sure.
But, we certainly talk about faith, and so from a Christian perspective, and so people know when they make an appointment with me that that's what I offer.
Yeah.
Mm-hmm. But before that, I just, I didn't. I mean, I just whatever, client came in the door, I took on. We didn't, if they didn't want to talk about faith, we didn't talk about faith.
Sure.
So.
And what's kind of the difference between like counselor, therapist, psychiatrist, psychology? What's the difference in all that?
I would say like therapists, they're the ones that really, I would say, do the therapy.
Sure.
Like they're going to spend like around an hour with you. They're doing like the talk therapy, the CBT therapies, the trauma work, things like that. A psychologist primarily, now they can do counseling,
sure,
but primarily they do testing to help figure out like a diagnosis.
Okay.
Like, do I have ADHD? Do I have autism? And they do a series of like tests to determine that.
Okay.
And some people need that because we don't often know exactly what is going on. And so in those cases, we do refer out to psychologists. Psychiatrists are medical doctors.
Gotcha.
And they go through medical school. And they diagnose, and they often prescribe medications, and they, kind of do this psychiatric kind of evaluation and determine kind of what's going on with this person. And they, if I'm not sure about a diagnosis, if I'm not sure, really if the person needs meds or not, I'm going to send them to a psychiatrist.
I gotcha.
So especially if somebody's really having significant symptoms, that may be the avenue to go. Of course, they would come to me for therapy. They would go to him or her for medication.
I gotcha.
Mm-hmm. Counselors, I would say, a lot of times people use counselor and therapist, they interchange that. But a lot of times I think of counselors like in the school system.
Sure.
You have counselors that are trained to work with students in that environment.
Yeah, that makes sense. The whole thread of the episodes, most people never go, but most probably should. And I guess, is that true? I mean, I don't know. Like, people need to go. Why do you think so few people ever try it? And then what do you think the benefits of going are?
Well, I would say, because I've been in this field a long time and in the South, I would say like in the late 90s, mid-late 90s, I do think there was a stigma, I really do. And I remember people even coming to the back door of our clinic,
sure,
not wanting to be seen. They'd knock on the back door,
sure,
we'd let them in. I do remember that time period. But it has, I feel like it's changed, and there's not as much stigma. And I think with the younger generation is more open to it. I think, we're just taught, a lot of us were just taught to handle things on our own,
sure,
and suck it up, and,
yeah,
and especially men, they're taught to be strong and just deal with it. And there's very few men that were just open to therapy when I first started out, but now that's really changing.
Yeah.
And I give credit to the younger generation for that.
Sure.
And just we're educating people more about it, and with social media and the internet and things, people are just learning more about it and more open to it. Now, I think for some people it's still hard for them to do it, and I think sometimes it takes something really hard to make them come in.
Yeah.
And could they have benefited before it got to that point? Sure. But it was just hard for them to come in until they were hurting.
Sure.
Which, think about it, when we go to the doctor, I mean, most of us wait till we're
sure
having symptoms or hurting
sure
to go. And so I think it's similar, but, but some people don't want to admit that they're struggling with something, and it's not the easiest thing to do. I think it's harder for some people versus others. But, you don't want to think I'm weak or I can't handle it. Or,
sure.
Or sometimes people are embarrassed by if I'm having panic attacks, and I feel like I'm different from everybody else, and why am I experiencing this? And you feel a little like, gosh, am I crazy? And this.
Yeah.
And I can see it's hard. But I do, on the positive side of that, I think people are are more aware and are more open to coming.
Yeah. Yeah, and in your mind, does or would everybody benefit from it? Meaning like every person listening could benefit from it versus like, I've had something really hard happen or a crisis or whatever.
I think, listen, I think everybody could benefit just from taking care of their mental health.
Sure.
Now, whether they need therapy or not. Now, I do get a lot of people who just come to talk. They're not always having something just major happen in their life. For some people, it takes that to get them in the door, and then they say, oh, this is not so bad.
Sure.
Some people, just come in and like talk. I think everybody can benefit from just taking care of their mental health, whether that be therapy or not. I mean, I think for some of us, listen, we all do therapy whether we know it or not, because I know when I'm stressed or had a bad day, I'm calling up my best friend, another woman who's maybe experienced like similar issues.
Sure.
And I'm calling her, and she is like my therapist,
Sure.
and I'm like hers. And there's times when, I'm just talking to my husband, but if I wanted my female perspective, I might be calling my friend, and like and so in a sense, they're my therapist, right?
Sure.
I mean, and there's sometimes I'm just going to sit with God and I'm going to lay it out, like I'm just going to go to God and we're going to have a discussion about what's going on. So, and God is the ultimate counselor in my mind. He provides us people and community, and He wants us to have those people.
Sure.
And so we do need to go to people. But I think all of us go to people. I mean, if we think about it, we may not be going and paying for therapy, but I think most of us get some kind of therapy. But we all need, I wouldn't say everybody needs to go into a therapist's office. I would say people need to take care of their mental health.
Yeah.
And not suppress things and not deal with their stress and, think they have to handle everything on their own. And God didn't design us to have to handle everything on our own.
Sure. Yeah. Mm-hmm. No, I like that. I mean, and even my journey, how we met, like I said, I was going to put on here, like I'm a patient of yours, client, whatever. And same where it's like, we spend a lot of time on our physical. I go to the gym, I track what I eat. I've had my nutritionist on the show before, you know what I mean? Like we spend a lot of time on that, but I don't think we spend as much on our mental health, just generally speaking,
and it's all tied together.
Yeah.
What we do.
Yeah.
Mentally, physically, all of that, spiritually, it's all tied together.
Yeah.
And, if you're physically going through something, it affects you mentally. If you're mentally going through something, it affects you physically.
Sure.
And so it's all tied together. Because sometimes we get clients that are going through an illness and it has just wore them down mentally.
Sure.
So, and the same with if you've been depressed for a while or anxious, and it wears you down physically. So it's all part of our health, right? Yeah.
Mm-hmm. Yeah, and I like the way you phrase it around like everybody needs to be talking to someone. Mm-hmm. You may not necessarily need a therapist
a mentor
per
or
se.
A coach. What's real big now is coaching.
Yeah. I have one of those
coaching.
too. She's been on. Yeah, I've had one of those too, or I have one of those too. I have a business coach I meet with once a month.
And people are less, or I think less anxious, or they have that less of a stigma of going to a coach.
Sure.
And it's really big now.
Yeah. Mm-hmm. No, it is. Well, and it's interesting because I was telling, so I work out with a guy and we were talking about like tracking what we eat and drink and all those kind of things. And I had a friend that was like, man, like I would lie. Like I wouldn't put down I had an extra piece of cake or whatever. I'm like, that just seems so silly to me. Like you're paying this person to coach you, but then you're going to hide from them the data. Like that doesn't make any sense. Like just don't pay them, And so I'm a big believer in having people around you that can help support you. And because I don't know, I want to be the best version of myself for my wife and for my kids and the people I'm around. And, if I need support in different areas for me personally, most people listening know me personally, but relatively traumatic childhood, went through a lot of tough stuff. I've had seasons where I did therapy, so for me personally, it's not been just a straight line, stay in it forever kind of situation, but I have like moments of life where I'm like, hey, I could really use some extra support. I think it would be positive for everybody, but maybe not. Maybe everybody doesn't get to that point, I
just think it's about mental health, and you may not get it from a therapist, but you're going to need it from somewhere. Yeah. And it may be from a church group that supports you.
Sure.
I do 2 women's groups, and that's a sense of mental health. It's support, and it's someone that you can text and say, pray for me, and they will. So I think there's different types of mental health, and I don't know that everybody needs like structured therapy.
Sure.
But are you taking care of your mental health?
Yeah. If someone decides, all right, I do want that, talk about like finding a right fit. Like, how do you literally go down that journey of finding a person, and how do you find them? And
that's so important because, you know, you have to feel comfortable. And luckily, these days and times, you can look the person up,
Sure.
right? I mean, if you go to our website, you're going to get a profile of each therapist and what they specialize in,
Sure.
what they do. I think a good resource too is like Psychology Today.
Okay.
You know, because you can go in there and kind of research different therapists and what you're looking for. That will even tell you the insurance that that person takes, and you know, and it covers different like areas around the country. So, you know, but I would say with social media, and you can Google somebody and find some things out. I don't know if it's all true.
Sure.
But we try to give all that information on our website, you know. And when people call up and say, I'm looking for this or that, and we try to help them with that and navigate through that. And we tell them, like, look, if I'm not the best fit for you, we'll find you someone. You know, we'll work with you.
Yeah.
Because you do have to be comfortable.
Yeah. Yeah, and I guess if someone's tried it, had a bad experience, what would you say to that person?
Well, I would just sympathize with them and say, you know, I get it, I understand it. You know, sometimes that happens, and, you know, I just try to reassure them I'm going to do everything I can to make this work.
Sure.
And if I can't help you, I say this all the time to people, I can't help you, I'll find somebody that can help you.
Sure.
You know, because we do have bad experiences sometimes. I mean, all of us that go into different providers, sometimes it just don't work.
Yeah.
Right? Or maybe it's just, and it's not always that you don't like the person, it's just like, this is not what I'm needing.
Yeah.
You know?
Yeah.
And it takes a few sessions sometimes to really figure it out, because the therapist has to get to know you. And I think the expectation sometimes of someone coming in, they think maybe if they're not familiar with therapy, they might think, you know, the first session, we're going to figure out all these things, and it just doesn't happen that way.
Sure.
And so sometimes you have to stick with it a few sessions to see if this is a good fit for me.
Sure. So talking about like practicals, people listening, you know, they may never walk into your office, but on the episode today, some practical tips. I put down in our notes, you know, I got feedback. Jess and I did a 10 tips for marriage. And we got so much positive feedback because we certainly don't have it all figured out, but we've been married 10 years, and we gave like practical, like these are things I can take and apply to my daily life. And so I gave us time to talk about like really teach us something, whatever that means, if it's daily coping, if it's bigger picture things, but like just walk through some things that the listeners could take away from today.
Okay. Well, being more of a Christian faith-based counselor, one thing I do talk about, and the American Association of Christian Counselors, which I'm a member of, they just sent out information on this. So there is research out there. But as a faith-based counselor, I talk about the importance of prayer.
Yeah.
And it's been shown that prayer over time and doing that consistently will rewire your brain.
Wow.
Okay. So prayer is so important. And you can go on their website and they have information about it. They have so much information. And Focus on the Family. They're two good resources for Christians.
And what was the first one? What was it called?
American Association of Christian Counselors.
Okay.
AACC.
Okay.
And but yeah, they really have a lot of good information. But recently they published something about prayer.
Okay.
And the benefits of praying. Okay. So, you know, I do talk about that's so important. And not everybody prays the same. You don't have to pray the same as another person, but just that time, you know, for prayer and alone time with God. And it's just important to have that time, if it's 5 minutes, if it's longer. And I know maybe not every day, but just consistently having that time with God. And if you don't have that time, are you thinking about God or thanking God or just talking to God in your mind? Is God a part of your day?
Sure.
You know, being in the Word, being in the Bible, I listen to little clips of preachers, some of my favorite preachers to inspire me for the day. What I tell people though, there's no judgment. Like, I think sometimes when we go to like maybe a pastor or a Christian therapist or something, they think, oh God, I've done all these awful things, I'm going to be judged. But
Sure.
I tell people there's no judgment because there's no perfection. We know that people are not perfect and never will be. They're not. That's why we need God,
Sure.
because we are not perfect.
Sure.
Humans are just not. We're sinful. We do things. We have problems. We have these emotions. And so there's no judgment, but we need God.
Sure.
And I've learned that the older I've gotten, the more I've been in this field, the importance of that. And we just got to be grounded, and we got to, really lean on God in some very difficult times, But I touched on, the importance of self-care and, teaching our brain very healthy habits, which prayer, is a part of that, rewiring the brain. But a lot of times people are thinking such negative thoughts, and you have to pay attention to that, and you have to really practice better thinking.
Sure.
I call it stinking thinking when
Yeah.
people, and you may have heard that term before, but it's stinking thinking. Like, we get in these patterns of this very negative thinking and self-talk, and we have to rewire that sometimes because our brain gets stuck there. Just like if we've been depressed for a while, or we've been anxious for a while, our brain almost gets, and our nervous system almost gets stuck in it, and so we really have to train our brain and our body differently to get out of that. And it takes work. And
Sure.
therapy is not, if you're really working on something pretty difficult, like, you can't just go in 1 or 2 times. You really have to, and most of the work's going to be what you do, not what the therapist is doing. There's no magic pill a therapist is going to do. It's what you do day to day.
Sure.
It's a process. It's a journey, and you know yourself better than the therapist does, and probably people in your life know you better. But so it's what you're going to do in your personal life, that's going to make the difference. But you've got to figure out, everybody's situation is different, so you have to figure out what the issue is. But are you doing self-care? Are you watching how you think? Are you having fun and laughter in your life and relaxation? Are you enjoying your life? Your health, you're taking care of your health, you have good stress management. Those things all are important, and you have to look at this, and this is what I'm going to break down with a client to see, where maybe they're missing, what's
Sure.
missing that
Sure.
we need to build back up.
Yeah.
But there's different strategies and different types of therapy. There's so many things, and some therapists are specialized in this treatment versus this. I do trauma treatment. So if something is stuck there, in the nervous system in the brain, we may do trauma treatment, which is basically, just a little eye movement technique that we may do. So it just depends on the person, but we really have to break it down and see what this person's needing.
Yeah.
And we have to tailor their therapy to that.
Yeah, I like how you say, you were talking earlier about coaching almost. And you're right in the sense that, even though we work together, you know me less than Terry does, and my wife does, and my best friend does. These people know me better. They know me longer.
They know you better, and you know yourself better.
That's right.
And
But
so,
you're able to coach and hey, have you seen this? I don't know that you've thought about this thing. And you can't solve everything in an hour. And it's hey, I want you to think about these things over the next 2-3 weeks, and then let's talk about them. And so it is very coaching in a way.
And I think when people in our life point out things to us because they've been around us so much, the people that really know us, I think we have to listen to that.
Yeah.
The people that love us, that are doing it out of love, just
Sure.
like God points out things to us.
Sure. Sure.
And people, and God uses people to point things out to us. And so I think we have to listen to those things. The
Yeah.
people who love us the most, I think we have to listen to that.
Yeah.
Because everything the therapist says is not going to be dead on or accurate.
Sure.
But I think you have to think about am I lacking in my life? Like, what are the areas that maybe I'm not doing a very good job on? And some people just don't even laugh enough.
Yeah.
You know, they just don't even laugh. They're stuck. Their brain is stuck in negativity. You know, and they've been through some hard things, or they've been depressed and they can't help it. I mean, that's a real, you know, disorder, and
Sure.
sometimes there's no reason for it except genetics, or just because their brain is not functioning like it should, and they kind of get stuck in that. And it's hard to retrain your brain to get out of that. So we just have to really work on it piece by piece. And you can get there. Like, you can retrain your brain to do anything.
Yeah.
You just have to work on it.
Yeah, I thought, you know, because we've done the blast together, and so like maybe talk about that for a second, because I've told people that even listen to this show about it, and it's fascinating to me. I'm very interested in the brain and how it works and the rewiring, all that. So talk about like, because you mentioned that, like the eye movements and the memories and.
Well, so I was originally trained in EMDR therapy, which a lot of people have heard of that because it's been around a long time. And even Prince Harry had it done because of everything he went through with his mom dying and everything. And so I would tell people to go watch that because I wanted people to see that this famous person is doing it, you know. And so it's used all over the world. It's not just in the United States, all over the world. And so it's so researched and effective. And so I got first trained when I worked with abused children and families. I spent about 10 years working with that. And so we wanted a kind of an effective way to help kids and teens and their parents, you know, work through significant trauma, really hard stuff, and without it being so stressful. You know, we wanted something that just would help to get them past that. So we all got trained, you know, that were working there, the therapist, and you know, and it took a while to get trained, and you had to go through the treatment yourself too. So and it's an eye movement, which EMDR you can do different ways. It first came out as an eye movement technique. It's called bilateral stimulation, and so you're actually trying to stimulate both parts of your brain, you know, and that process helps the brain kind of move past like stuck kind of trauma and memories. Trauma just stays in the brain. It's not like other memories. It just kind of stays stuck in the inner brain. And so, and there's a lot of research about it and everything. But, you know, and I did a lot of EMDR, and I think it is effective. But sometimes it can be emotional, and there's a lot of steps to it. It's a great treatment, and I'm sure not the expert on it. And it's pretty, like, they're coming out with all kinds of things you can do with EMDR now. I mean, it's pretty intense. But so when I heard of blast, so this is a newer approach from Nick Davies, who lives in England, and he took all of the trauma therapies that were out there, and he really researched everything, and he came out with something called blast. And it's a bilateral, I can't even remember, I'd have to look. We're so used to saying blast. Actually, it's bilateral, you know, stimulation treatment. But it's, it probably has another word in there somewhere. But he just wanted it to be quicker and less stressful for people, because sometimes EMDR could be emotional. It took a while to do that. So he came out with this technique, and I just became very interested in it. Some other colleagues introduced me to it, and we decided to do the training because we just wanted something quick, you know, that would be not as stressful on the client. And so, and I really did like it. I mean, we went through the training. I've done a couple of trainings with it. And certainly there's people that are even more trained than me, like, you know, with it. But it was quicker, and I felt like it was overall pretty effective. I'm not saying it works for everybody. So now I do more of that. I mean, it still uses bilateral stimulation. It's mostly with eye movement, which EMDR you can do. You can do like tapping techniques, and you can do sounds and light bars where you're watching lights. Now blast, you pretty much, you know, I use a lighted pen and you just watch it, and it looks like I'm doing hypnosis or something, but it's not. It's eye trance, and so I don't know, like, if Nick Davies he's so smart, and he can break down why it works. I can't tell you exactly why it works.
Sure.
The brain is complicated.
Sure.
But I can just tell you, people get a sense of relief from it, and I'm not saying now it fixes everything. I'm not saying that, but it's a part of what we can do to help.
Yeah. Which I think to me is like why you do, like we talked about earlier, talking to people, get that, but you don't necessarily get that clinical side of it unless you're going to see somebody. Does that make sense? And then you're like putting all the pieces together where you're like, yeah, you had this really traumatic situation. Let's use some more like medically science-based on that piece, and then let's take these other pieces, so I've enjoyed that part of it. Yeah.
Yeah, it's fascinating, and I'd say if it helps, why not?
Sure. Yeah.
It's just another piece of it.
Sure. And I like too how for you you're faith-based, because I think people that are Christians have that also in the, I know I've had that thought before, like, hey, I'm letting someone in my mind kind of tinkering around. I want to make sure I can trust that person. We don't have to believe exactly the same, but at least we have the same sort of foundation. I don't want someone with like dramatically different beliefs than I do tinkering in my mind. At least I don't. But I think that's a good thing to be faith-based, because I think a lot of people have that also as a barrier to wanting to go try therapy or get counseling or whatever, because they've been taught, no, that's what pastors and preachers are for. You don't need the psychologist, psychiatrist that's,
Well,
not as conservative and not
Christian.
Yeah.
I think when I was a child, I didn't know what therapists were. I had when I decided to go in the field, I didn't really know much about it. I thought I was just going to help people. There's so much more to it.
Sure.
But I thought I was just going to help somebody that was hurting. I didn't want anybody to be alone in their pain, because and certainly things happened in my young years, and it led me to this, but I knew nothing about therapy.
Sure.
People went to their pastors. I mean, people, if you had a problem, you called the pastor, or that's, when I was a kid, that's what you did,
Sure.
And I think for most of us Christians, if we grew up in Christians' homes, a lot of times we did go to church or a pastor, which is a great place to go, and sometimes that's what you need to do. But if you are searching for therapy and you want a more Christian perspective, we have it. We're available. There is probably some others in the area as well. The only thing I would say is I'm not trained as a pastor, and I don't preach to people because I don't have that knowledge base.
Sure.
My friend John that's in the office, he is a trained pastor. Now, he doesn't advertise himself as a faith-based counselor. He separates it, but he will do it, but he doesn't assume that's what you want. But he is trained as a pastor.
Sure.
So we do have him in the office as well.
Sure. I love that. Was there anything else you had as far as teaching us things?
Well, I would just say that you gotta put mental health as priority, and I think, if you don't, you're gonna feel it, and especially the older you get, you will feel it. And so, if you don't have a good support system, if you don't have church and people that are just part of your circle that you can talk to, do therapy. Because you can come in and just talk. It doesn't have to be for, I'm depressed or I'm anxious, and people do come for that reason, but people sometimes come because they just need somebody to talk to.
Sure.
So there's different reasons for therapy, And so I would just say, if you don't have a good support system, then come to therapy. Don't hold those things inside. Because you will feel it. It'll come out in some way, And listen, you gotta enjoy your life. We're only here for whatever time God wants us to be, and you gotta enjoy your life. We have to somehow, move past hard things, and and sometimes it's very hard to think of doing that when you're right in the middle of it. But you have to have, that support, and you have to enjoy your life.
Yeah, I like that you said about having fun.
You have to have fun.
Just have fun and laugh, and don't be so serious. And
you have to, my worst days, I'm laughing and smiling because it tricks my brain into thinking I'm better than I am.
Yeah.
It does.
Yeah.
Just exercise and things like that help us.
Sure.
And I tell people, if you're having a bad day, find something to laugh about. Get distracted with a friend. go for a walk and put on like praise music or something or your 70s disco music or whatever.
Sure.
So I grew up in the 70s, and a little bit in the 80s. But you got to figure out like what helps me. And sometimes when you're anxious, I tell people, go turn on a cold shower, because the coldness is going to increase your dopamine.
Yeah.
You have to have little strategies like that. You have to know what to do in those moments, right?
Yeah.
But don't just sit in it. Or you may have to call somebody to lift your spirits,
Yeah.
you know? But you have to have these strategies. Don't just sit in it, do something about it. Be proactive in it.
Yeah. Yeah, don't just sit back and let it happen to you.
Right.
Like find what works for you and make it happen.
But if you need, if you don't have a good support system, find one.
Yeah.
Find. I mean, that's why I started 2 women's groups. They're free. They're on Saturdays. So reach out to our office if if anybody's interested. I do have people from different areas coming over to my office, which is of course right off 41. So, I mean, if you need a support system, let me know.
Yeah.
I'm thinking about starting another group in the fall, and I was just talking about this earlier with a client, and I was trying to encourage him to maybe be a mentor, and I want to call it, and I got to pray about this, but when life gets hard, and for men and women, when life gets hard,
Yeah.
or when things get hard,
Yeah.
and so that's something I'm kind of praying about.
Yeah. I love that.
And it'll be free.
Yeah.
Because that's my ministry. I'm going to do like free kind of supportive things when I can.
Yeah. That's awesome. Well, anything else you wanted to share? Always at the end, kind of like give space for like, hey, we had all these questions, but you may have something on your heart that you wanted to share that we hadn't even got to yet.
Yeah, I just say, we try to offer a lot of things for people. We even have, groups for first responders, military. So we have support for people who have lost someone through suicide. So I would just say, if you're looking for something, please reach out to us. The reason I went into therapy is I didn't want anybody to sit alone in pain. And so if we can help you, we will. We'll refer you somewhere that can. But just know that I think God is with you, and what I've had to learn is God is with you through the good, the bad. You've got to lean on Him for healing. Sometimes you just got to give it to Him and surrender it to Him. But, I think that's the most important factor. We've got to have God in the center of it. And He has worked on me. It's like He's the potter, I'm the clay. And I mean, He's done a lot of work on me, still working on me. And there's times I think He was probably like, what am I going to do with you? Like, what am I going to do? Like, I'm telling you what to do. What am I going to do?
Sure.
So you have to listen to that and what God's trying to tell you to do and have faith about that.
Yeah.
But yeah, any questions you can feel free to reach out to me or anyone in our office.
I love that. I'd love to see that study about prayer rewiring your brain. That's fascinating to me. That's super cool.
Oh yeah. I mean, there's things that really can help your brain help. There's a psychiatrist that I started listening to too more and more, and his name is, this is not made up, his name is Dr. Amen, but Amen, I think is how you pronounce it.
Sure.
But it's spelled like Amen.
Okay.
And he is Christian, but he's a psychiatrist, and he really studies the brain.
Okay.
And it's helped me so much listening to him. Now, he is actually speaking at the AACC in September, which is going to be in Texas, which I don't know that I can go. But he is incredibly interesting, and he talks about just different disorders and diagnosis and the best ways to treat it. And he shows you on scans what's going on in their brain. But I think it's so funny that his name's Dr. Amen.
Yeah, that's cool.
And how I found him.
Yeah.
And he sells natural supplements. I think a lot of people are scared of medications.
Sure.
And I think some people feel like if they come in, we're gonna push them to you need to get on medication.
Sure.
That's another fear of people. But I don't do that. We don't do that. I can't put anybody on medicine anyway. But there is a natural approach to this too, and so there are things that you can do that's part of just your nutrition.
Sure.
So don't be scared of like, oh, I'm gonna have to go on medicine, and sometimes that is the best course of treatment, but that's not always the case.
Sure. Yeah.
If you come in and talk about how depressed you are, we're not gonna like try to go put you somewhere in the hospital.
Sure.
That is kind of a fear I think people have.
Yeah.
So just, but we're there. If anybody, needs anything, just reach out to us, I would say.
Yeah. I love that. Well, hey, thank you again for coming on the show. Hope everybody enjoyed listening to it. And
I hope so.
Yeah, do a quick Google search. You can connect with Susan and her team there at EnSpire, right across from Smoking Pig.
Yeah, I can't miss
in
us.
Valdosta.
And we have different hours depending on your schedule. We have different hours available, and we have lots of choices of therapists.
Yeah, that's awesome. Well, thank you so much.
Thank you for having me.
Yeah, for sure.
Enjoyed it.
All right, guys, y'all keep doing life well. We'll see you again next month. Thank you.
Thank you for joining us on the Do Life Well podcast, where we explore topics like fatherhood, business, health, wellness, and so much more. With each episode, we aim to inspire and guide you in embracing the art of doing life well. If you found value in today's conversation, please leave us a review, subscribe, and share with your friends. Until next time, continue the journey of doing life well.